We are live, sir.
Thank you. Very good evening. I'm Dr. Nilesh Balkawade, Clinical Head at Oasis Fertility Pune at Wakad and Kharadi branches. I welcome you all for today's FB Live session. And today's session is on screening before pregnancy, what all things we need to know. It also encompasses preconception counseling as a part of it. So, what all things we need to screen before pregnancy? A pregnancy is a period of changed physiology or physiologic alterations, and therefore when a woman decides to go for pregnancy, she should have her health checkup done, she should have a counseling being done, she should get some tests done. If she is already on medications, she should get it tested whether these medications are safe in pregnancy. She should check her vaccination status and get her vaccination done. Avoid any teratogenic drugs. So this is in nutshell about what should be screened and what should be done before a patient goes into pregnancy. So we'll see this one by one. What all we need to know about screening before pregnancy. So for the health to be good, first and foremost is the patient's habitus should be proper. So it should not be a undernourished or a overnourished woman, which will cause problems during pregnancy. So proper body mass index should be there before going for pregnancy. It is acceptable that in Asian population or in Indians, the body mass index should be between 18 to 23. And if the body mass index is below 18, we call this as underweight. If it is between 23 to 28, we call it as overweight. And when the body mass index is above 28, we call it as obese. So a proper a ratio of weight and height should be maintained. Modification in this factor should be done with a proper dietary advice, which includes avoiding junk food, avoiding high carbohydrate or simple carbohydrate foods, and taking more of complex carbohydrates, protein rich food, foods rich in vitamins and minerals, that is fresh vegetables and fruits, should be a component of any woman who is going for her pregnancy. Exercise forms an important aspect of this treatment, where uh, a moderate regular exercise of around 40 to 45 minutes forms an important aspect of any good health of a woman. Thirdly, if there are any active or passive addictions, this should be kept off. So screening should include a proper history taking of woman, which encompasses all this personal history, which is very important, and they should be avoided to refrain from addictions. Then comes screening related to certain medical disorders, which can be undertaken before a patient goes into pregnancy. Now, what are these? Important investigation, which is a primary investigation, is a complete blood count, checking for the hemoglobin percentage. And if the hemoglobin percentage is on a lower level, we try to improve it by finding the cause and then treating it. If it is due to iron deficiency anemia or vitamin deficiency anemia, this can be treated by the supplements of iron or folic acid B12 combination. If the cause is due to hemoglobinopathies or hemoglobin abnormalities such as thalassemia, sickle cell anemia, and so on, if the suspicion is high, hemoglobin electrophoresis tests can be done. And this test is very important if the mm, couple or any of the husband or wife has a history of hemoglobin abnormalities in their family. Also, if their hemoglobin levels are persistently low, they can be carrier of any of these disorders, such as thalassemia trait. So, if the wife is a carrier and if the husband is a carrier, there is a 25% chance of affection of the baby. And therefore, in that case, if the test of wife is done and it comes to be a carrier or a trait in that patient, the test of husband also needs to be done for hemoglobin electrophoresis. Another important investigation is uh, blood grouping, that is ABO blood grouping, as well as the RH blood grouping. So if there is RH incompatibility, if the wife is RH negative and the husband is RH positive, and if the wife has had got any previous history of abortions or blood transfusions, she is in the likelihood of having RH isoimmunization during pregnancy, that is, problems with the mother and the baby's blood group, and the baby may have fetal anemia later on. And therefore, these patients needs to have a separate counseling regarding this. Other tests related to this can be done in the form of indirect Coombs test. Another important investigations is testing for viral infections. The commonly tested viral infections are HIV, hepatitis B, hepatitis C, and VDRL. VDRL, of course, treponema disease, which is a bacterial disease. This is also being investigated before the patient goes into pregnancy. And suppose if any of these viral markers are positive, the counseling should be done accordingly. If it is HIV and if it is the HIV is serodiscordant couple, accordingly the management might change, and therefore this viral marker testing is very very important. Along with that, another virus which can be tested is the rubella virus, and antibodies to rubella can be tested by doing rubella IgG antibody and IgM antibody. If the patient is not having a rubella IgG antibodies, that means the patient is not infected any time, or if the immunity of vaccination is gone, these are the candidates in whom rubella vaccination should be seriously considered before the patient goes into pregnancy, because we all know that there is some entity called as congenital rubella syndrome, which might affect the baby in a very big way, causing multiple congenital abnormalities to the baby. Another important investigation is assessing for thyroid dysfunction. A very simple test is assessing uh, thyroid stimulating hormone levels, that is the TSH levels in the blood, and this can give us, if the TSH levels are high, this indicates that the patient has hypothyroidism. If the T3 T4 levels, there is a thyroid hormone levels are normal and only the TSH levels are high, this is called as subclinical hypothyroidism. If the TSH levels are low, then this can be hyperthyroidism. Before the patient goes into pregnancy, treatment of hypo and hyperthyroidism is mandatory so that the patient doesn't have problems in during pregnancy. And if it is a hypothyroidism, even the baby can have problems such as mental dysfunction and other related disorders, and therefore these patients should be treated before they venture into pregnancy. So assessment of thyroid function is a very important aspect, and certain medications needs to be started for hypo and hyperthyroidism. Assessing the patient's blood pressure is again very important. We have to ask the patient history if the patient had any history of hypertensive disorders during the past, and therefore if the patient is taking any antihypertensive treatment, and if the patient is taking any antihypertensive treatment and those antihypertensives are not safe in pregnancy, this can cause serious health consequences to the fetus later on in the life, and therefore uh, any such medication should be changed. Next is the blood sugar level assessment and screening for diabetes mellitus. So, if the patient has not been previously diagnosed, but the blood sugar levels, the random sugar levels are more than 200 milligram percent, or the fasting sugar levels are more than 110 milligram percent, the postprandial levels are more than 140 milligram percent, these patients are at high risk of having diabetes mellitus. Again, they should be tested by doing the HbA1c levels and so on. And if present, these treatments should be started even before pregnancy so that there are no additional complications during pregnancy. Then a proper history taking is very very important, with in the form of any presenting complaints, personal history, family history, past history. In the past history, we need to analyze presence of any medical disorders or surgical disorders which can complicate pregnancy. Medical disorders such as hypertension, diabetes, hypothyroidism can complicate pregnancy. if the patient has any history of uh, miscarriages, any history of recurrent pregnancy losses, these are the patients in whom we can do evaluation properly and then only ask them to go for the next pregnancy. So karyotyping analysis, analysis of the sperms, analysis of the sperm DNA fragmentation can all be undertaken before the patient goes in for pregnancy for the next attempt. If the patient has any history of fibroids, needs to be ruled out by taking a proper gynecological history, which can rule out any presence of any previous infections, vaginal infections, pelvic inflammatory disorders, tuberculosis, and any other disorders such as adenomyosis and fibroids, which can complicate pregnancy. So all this history should be undertaken. Once this is taken, next comes is starting with the primary prevention, and this can be done. We can avoid neural tube defects by starting high dose folic acid and vitamin B12 and pyridoxine to these patients who are likely to become pregnant 3 months before their pregnancy occurs, and this will help to prevent neural tube defects. So starting off periconceptional folic acid and B12 forms an important aspect of preconception counseling and screening before pregnancy. Nowadays we all know that vitamin D levels are quite low in Indians, and many Indians are either vitamin D deficient or vitamin D insufficiency is there in these patients, and therefore vitamin D supplements can be given in the form of injectable vitamin D or oral supplements in the form of capsules or liquids, which can be given to these patients to improve their vitamin D levels. Certain medications are teratogenic, and these can cause problems to the babies. So screening should be undertaken to ask the history of any medical medications being taken, or if the patient is on any medical disorders, then any medications being used right now. If the patient is having epilepsy and using anti-epileptic medications, many of these anti-epileptic medications can have serious health issues on the newborn, and therefore safe anti-epileptic medications should be taken with the help of neurologist or gynecologist. If the patient is on hypertensive treatments, antihypertensive treatments, and if the patient is taking angiotensin converting enzyme inhibitors or angiotensin receptor blockers such as enalapril, then these patients are likely to end up having problems in the baby, and therefore these antihypertensive treatments also needs to be modified accordingly, according to the pregnancy safe medications. After that, if the patient has diabetes mellitus and the patient is on oral hypoglycemic agents, all oral hypoglycemic agents are not acceptable in pregnancy, and therefore a proper history taking should be undertaken. And pregnancy safe oral hypoglycemic agents such as metformin or glyburide can be used other than the other agents. In pregnancy, these patients also need to be counseled that their sugar control should be proper before they venture into pregnancy, and therefore HbA1c levels are mandatory in such patients. The HbA1c level should be less than 7 before the patient goes into pregnancy, so that she doesn't land up into complications. So congenital abnormalities are commoner when the mm, HbA1c levels are quite high, and therefore all this should be a part of the preconceptional counseling and preconceptional screening before pregnancy. Another important aspect which we can detect here before when the patient comes to us during this period of preconception is that whether the woman is vaccinated against certain important disorders which can cause serious health issue not only to the mother but also to the baby in the form of rubella. So if the patient is not immunized against rubella, then we can give rubella vaccine for such patient, and we can ask her to wait for 1 month before she goes into pregnancy till her immunity is established, which later on she can go into pregnancy safely. Regarding other vaccinations, hepatitis B vaccination is an important aspect of treating in preconception. If the patient hasn't received any doses of hepatitis B vaccination, it is prudent that the patient receives a complete course of hepatitis B vaccination before she ventures into pregnancy. So These are the important points about screening before pregnancy. Screening for high risk disorders such as diabetes mellitus, hypertension, asthma, epilepsy, and so on. And accordingly, we need to change our treatment, change our plans so that the patients get benefited to whole extent during the preconception. So, thank you so much for a patient hearing. We would like to answer few questions which are given here. Is there any solution to genetic problems? So yes, right now we cannot change the genes. The CRISPR technology, which has come up for changing the genes, is not allowed. But yes, we can detect certain genetic disorders. We can test the embryos by doing a pre-implantation genetic testing, and only those embryos which are tested to be normal can be inserted inside the uterus, and this can give better results. So genetic problems, though difficult to assess sometimes, if we find out certain genetic problems by doing karyotyping testing, microdeletion, or whole genome sequencing, these are the patients who can benefit from pre-implantation genetic testing, which is done even before the pregnancy occurs. And this is done with the help of IVF. We form the embryos and then we biopsy the embryos and send it for examination. Next question is, what is the purpose of screening in pregnancy? So the purpose of screening in pregnancy is to detect high risk patients, such as patients with having history of any pre-existing medical disorders, treating these disorders, changing the medications if they are not pregnancy safe or they are teratogenic, uh, to check for general health of the patient, improve the general health, check for certain common disorders like thyroid disorders, hypertension, diabetes mellitus before they venture into pregnancy, check for certain obstetric factors. If there is a previous bad obstetric history, check for that and try to improve that by doing a proper history taking and examination along with laboratory management if needed. If there is a history of recurrent pregnancy losses, we can do karyotyping and other analysis, genetic evaluation of the patient. Also, the purpose of screening is to give vaccinations, if not already started, to the patient, to give certain medications which are considered to be beneficial for pregnancy, such as folic acid B12 supplementation, and nutritions should be good nutrition should be ensured before the patient goes into pregnancy. So all this we can do as screening for before pregnancy. Next question is, which tests are done before pregnancy? So I already answered it. We have to rule out thyroid disorders, hypertension, blood sugar levels, rubella infections, viral infections, if any, hemogram, hemoglobin electrophoresis. All these are important aspects. I'll not go into details so far. I have already taken it, but this is how we can test a patient before she goes into pregnancy. Next question is, what screening test will be offered in pregnancy? So during pregnancy, we can do certain screening tests to identify high risk mothers. We can do certain screening tests to identify problematic babies. So we can do first trimester screening, which will be for detecting any chromosomal abnormality in the baby. Also, the first trimester screening can detect any problems with the mother, and this can be in the form of um, the screening test which will be offered in pregnancy. So how long? Next question I'll take. How long do screening tests take? So this will be a one session about history taking, and then we have to go to the laboratory investigations in the form of the investigations which I mentioned, and this will be based on the patient's history, and there are certain general investigations which we can do uh, before the patient goes into the pregnancy. Next question is pros and cons of genetic testing. So not each and every patient needs genetic testing, but those who have history of genetic problems in the family, those who have previously affected babies, if there is a history of recurrent pregnancy losses, if there is a history of recurrent IVF failures or implantation failures, all these are the patients who might require genetic testing. And if we are able to detect any genetic abnormality, we can even try for its solution by doing a pre-implantation genetic testing and detecting a normal embryo and transferring that. Next question is, what happens if the Down syndrome test is positive? So the screening during pregnancy, it takes into consideration this screening for diabetes, Down syndrome, trisomy 18 and trisomy 13. And if the Down syndrome test is positive, the screening test is positive, then we go for a confirmatory testing, which is the chorionic villus sampling or amniocentesis. And then we, after doing this testing, we send we if the confirmatory test is also positive, then we have to go for termination of pregnancy if the pregnancy is before 20 weeks. And if a permission of the court is taken up to 24 weeks also, we can terminate the pregnancy if it is a Down syndrome positive. So this is about today's talk. So if you like the talk, please share the talk, like the talk, and share it to your near and dear ones who require it. If you have any query related to fertility, contact us on our helpline number, which is given below. If you have any questions you want to contact with us, uh, we can visit any of our centers in Pune, which is Oasis Fertility at Dynasty Commercial Wakad or Oasis Fertility at Arisa Avenue, Kharadi. Thank you for patient hearing. Thank you.